So in 1970, when community hospitals were closing and private docs were leaving the city, a group of community leaders were searching for a way to make sure that healthcare was covered for the community. Ricardo Guzman, who helped found the center in 1970, was one of those leaders that saw that need and went to get the first grant for the center.
I was 72 or 3 when I was politically involved in the neighborhood, and I seen this trailer sitting in a parking lot.
It was a well-baby trailer that was set up just up the street on Junction in front of Holy Redeemer. They were taking care of newborn babies and kids. Then in 1976, they moved right next door to where we are today to a used car dealership. It was run to Oldsmobile. And that was retooled to be a medical facility, which wasn't very efficient. We needed to move into a new facility. So in 2006, they started the space planning, and 6 years later, we moved into this facility.
It's like an icon. It's more than just a medical service that they provide. I would not know anyone in the Southwest Detroit area that wouldn't be familiar with CHASS.
The fact that we've been here 55 years kind of shows that we are the pillar, as you say, of healthcare in this community. We're the subject matter expert. Everything related to health, they know that they can come here and that they are able to use what we're offering to improve their quality of life.
Yo soy paciente de la clínica CHASS desde el 2011. Yo en mi búsqueda, cuando llegué aquí a Detroit y me hablaron de la clínica CHASS, yo le pedí a Dios poderme encontrar con que me pusiera una buena doctora, que comprendiera y entendiera lo que yo necesitaba. Pude ver que esta clínica se preocupa por nosotros y nos ayuda a poder expresaron en nuestras necesidades, y yo el ver cómo le interesaba a mi doctora mi problema emocional como físico, y ver cómo ella se interesó en escuchar mi sentir, pues se logró lo que hoy tengo, que es a mi hijo, y estoy muy contenta por eso.
We care deeply for our patients, and we understand also the barriers that come with what they might be experiencing. Because a lot of us have grew up in this neighborhood, they know like what needs to be taken care of, that extra step that maybe a different center in a different location they might not be aware of. So I think that just the compassion of just the providers, the understanding of staff and the community that they're serving.
We're just happy that they're still around, because we don't want to go anywhere else. We're just happy coming here to see the doctor and getting good treatment.
About 70 million people in the United States have Medicaid insurance. It's critical for us to be able to leverage the Medicaid reimbursement to care for those individuals, to help offset some of the costs for services that are not covered by the Medicaid. Doula services, community health worker services, outreach and enrollment. We're advocating heavily to make sure that the changes that are being proposed to Medicaid do not come to fruition, because it would be a backbreaker for health centers across the country.
I think that CHASS has just a deep sense of commitment to the community.
To see it just continually keep getting bigger and bigger and expanding, it's really satisfying, because it does provide a great service to the community, gives medical attention that people would be apprehensive about going. They come here with no problem.
The support that we receive from our funders, from the federal government, is critical for us to be able to expand not only the services that we deliver, but the number of individuals that we deliver services to. Last year is about 11,000 patients. Our goal is to be able to deliver equitable, accessible health and wellness to every single community member.